Hello and welcome. My name is Kate Williams and I am an MSN student from Chamberlain University doing my healthcare policy practicum project with ANA Vermont. Today's microlearning is an interview, a discussion of nurse advocacy, adventures and advice, an interview with ANA Vermont President-elect Dr. Betsy Hassan. For the best listening experience, please use a headset as the volume changes during the interview. Thank you. Here is a little bit of background about ANA Vermont. The mission for ANA Vermont is to advocate for the nursing profession, health for people in Vermont, and affordable access to quality care for all. ANA Vermont's vision is to inspire Vermont nurses to advance the nursing profession and the health of Vermonters. ANA Vermont is a professional association for nurses in Vermont and established in 1914. It has a long history of supporting nursing practice at state and national level. ANA Vermont offers networking, professional development, political advocacy, and more, and recently led a reorganization in 2022 and 2023. Let's meet Betsy Hassan. Dr. Betsy Hassan is a board-certified nurse leader and holds a doctorate of nursing practice from the Massachusetts General Hospital Institute of Health Professions. Her professional areas of expertise include advocacy, workforce development, professional development, shared decision-making, and leadership. Betsy has been active in ANA Vermont since 2017 and is currently serving as the 2024 President-elect. Welcome, Betsy, and let's get right to the questions. So let's talk about nurse advocacy. Tell us about your experience advocating for Vermont nurses and patients.
So I began my advocacy journey back in 2017 when I joined ANA Vermont after relocating from Maryland. I am originally from Vermont, and so I knew that once I began my nursing career here that I wanted to make sure I was involved in advocacy, and I knew that through ANA Vermont that really was the best way for me to do so. I have participated in the ANA Vermont's board in a number of roles, serving as vice president, membership assembly delegate, and now as president-elect. I also participate in a number of other professional organizations, such as the Organization of Nurse Leaders, that also allows me to voice Vermont's nursing practice and policy issues at the regional level.
Wow, thank you so much for that. Do you have an example of an act or bill where ANA Vermont was instrumental in supporting?
Yeah, so I would say last year in S36, which was in an act, which is now Act 24, when it was signed into law by the governor, that allowed for violent offenders in the care setting to be arrested and removed. And it was really important that nursing's voice was present in this conversation, as we often serve as the most, I would say, impacted by some of the violence in our care settings. And so this was a place where ANA Vermont could really bolster the nursing workforce, make sure that they were up to date, and that they had the right information in supporting the law and partnering with our legislature.
Thank you, Betsy. It's so important to advocate for nurses that way and have the voices of nurses heard. Do you have an example of an act or bill where ANA Vermont was instrumental in opposing?
Yeah, so we actually served as the lead witness in testimony regarding H-171 last year, which is an act relating to adult protective services. First and foremost, ANA Vermont strongly supports the need to report abuse and neglect of vulnerable adults, but what was interesting about this legislation was that they were attempting to expand mandatory reporting to include negligence within the definitions of abuse and neglect, including the negligent failure or omission by a caregiver to carry out a plan of care. So really, when we thought about medical errors and basically just the daily work of a nurse, this really could be impactful from either a nurse having to report any sort of medical error or omission of not only themselves, but also their peers, because they are mandatory reporters as well. And so we really wanted to make sure that the legislature understood a culture of safety and the things that need to go into that, which really include the ease of reporting of medical errors, to learn from them as defects from a system, not of those of an individual. And so serving as the lead witness for a healthcare association coalition, this was a really important point for ANA Vermont because, again, we would be the largest workforce that would be affected by this legislation. And I would, say that because of that testimony, as well as our partnerships with our other professional organizations, we will able to persuade the legislature to not have this language move forward.
Oh, that is so important. Advocating for a just culture and protecting nurses as well as patients, so very important, and such great pride in being the lead witness for this important work. Thank you very much for that. Betsy, it was great to hear how ANA Vermont was the lead witness for that testimony. How did you prepare for your testimony?
Well, I think this is a really great point, is that testimony is given in two ways. You have your written testimony that you submit, and then you also have the opportunity to provide oral testimony. And so in your written testimony, you can be much more detailed. You can provide, really complex points that you want to get across in writing. But really, with your point with written testimony is to persuade. And so this is where you really want to take the opportunity to highlight the key points of your argument. And so in preparing to do that, you provide, you write your written testimony, but then you also start to map out an outline for what your oral testimony is going to look like.
Okay, very good. And what was the testimony experience like for you?
Well, it was interesting because this testimony was provided with the hybrid ability to either be in person or on Zoom. And so I was able to Zoom in on my workday, be introduced, by the Senate committee I was testifying for, and I was just given the floor. They were able to ask me questions. I was able to listen to everyone else's testimony, and it was a really easy way to participate in making sure that we had the ANA Vermont voice heard.
And what is the best way for a nurse in Vermont to prepare to give testimony?
I would say the best thing to do is to make sure that you have a solid written argument. That's really going to serve as the framework for what your oral testimony is going to be. And you want to practice. This isn't something that you want to appear to be reading off of. This really is a candid way for you to provide information to the legislature. And so it always is better if you practice with friends or colleagues, and to make sure that your argument is sound and is the intent that you want to get across.
Those are excellent points. Thank you, Betsy. And Act 24 is an interesting one for us to discuss. Act 24 is an act relating to crimes against healthcare workers and against medical treatment providers. At the time of this interview, Act 24, an act relating to crimes against healthcare workers at hospitals and against emergency medical treatment providers, has yet to be finalized into policy. I was able to advocate with you in a very small way, simply by requesting the public records of the meeting minutes regarding this work. What are the next steps for this work?
So this is something that I had mentioned previously, that ANA Vermont supported Act 24, and this was a really momentous moment for healthcare workers to feel supported by their legislature and it was sort of a recognition of how violent the care environment has come, and that healthcare workers deserve to be protected too from violent individuals. In part of this work, there is a model policy that needs to be developed, which really serves as the way in which law enforcement and healthcare workers partner together in terms of training, and to ensure that law enforcement and healthcare workers understand each of their roles in this process. And so what we worked together on, Kate, was that we found minutes from the Law Enforcement Advisory Board that noted that a model policy was being developed and that it needed additional input from the Emergency Medical Services Advisory Board. And so we wanted to find out what that policy was looking like. And so we did a public records search, a request to find out what that information was. And we were able to establish that there was lengthy time in between meetings, and that really there was a lack of forward movement or initiative in ensuring that this policy was developed appropriately and that training could start to occur. I think one of the most concerning things for ANA Vermont is really that our nursing workforce and our healthcare workforce really is continuing to see an escalation of violence in the care setting. And we also know that that's a big deterrent for people staying within direct care. And so we want to make sure that this work doesn't get lost in sort of a bureaucratic limbo between, advisory groups or policy development. And we just want to make sure that our membership and our workforce is well protected, and that this work continues to move forward.
Yes, this is very important work to continue to follow and advocate for. And I'm really honored and feel very proud to be part of it. Thank you. Another act that we're following, H121, an act relating to the enhancing consumer privacy. Tell us about why ANA Vermont opposes H121, an act relating to the enhancing consumer privacy.
Sure. So this bill really looks to add additional requirements to data privacy. We know that healthcare information are really only subject to one state and federal law, which is HIPAA. And so what this does is it provides two separate privacy notices to patients, or would provide two different privacy notices to patients that are actually inconsistent. And so this would add additional training to nurses and other staff to learn about these conflicting privacy laws, and then the costs that are associated with training a whole entire workforce around this really sort of seem exorbitant and also burdensome. Really what we're looking for in partnering with the legislature is that they are focusing on reducing administrative burdens for healthcare providers, because our job is really improving patient care. So there are some exemptions that we would look for, and we'd hope that healthcare organizations would also be exempt from this Privacy Act as well. Just really understanding that, our focus should be on patient care instead of addressing concerns about, multiple conflicting privacy laws.
That's a great point, and it's a lot of work that goes into this, and it's so important for this advocacy work to happen, and for ANA Vermont to be so involved. This is great. Really, really good stuff. So to kind of review things, our top legislative priorities, what are they for ANA Vermont in 2024, and why?
So this year, in working with the legislature, we're really focusing on prior authorization, data privacy, but then also that continued implementation of Act 24 from last year. Mm-hmm. I'd also say that, our biggest needs are also always, our biggest priorities are also following any sort of workforce development funding and appropriations. We want to make sure that we're advocating for where we think nursing, either scholarship or grant awards, should be included, as well as how that can be diversified and spread throughout our working nurses in the state. I think one thing that, the legislature did a really great job with last year was developing the preceptor incentive grant for nurses that are working directly with Vermont-based nursing students. And so this was one of the first times that the legislature actually recognized the contributions of the working nurse as opposed to the nursing student. And so those are the types of things that we really want to bring forward. So it's not just developing a workforce and increasing student numbers, but also recognizing the amount of training and as well as the expertise that is in direct care right now, and retaining our nurses in the state is really important to us.
It is. Retention is so important. This is great work that ANA Vermont is doing. Is there anything else you would like to share with Vermont nurses regarding advocacy work?
I think the most important thing is to just start learning, understanding the ways in which nurses are involved in the healthcare conversation at the state and federal level, but then also noticing where they're not involved. I think that Vermont really serves as a leader in healthcare reform, but I often find that the nurse's voice can often be second in those conversations. So making sure that we're at the tables that we need to be, and it really comes with being involved and being knowledgeable. So, I think using the resources from ANA Vermont or partnering with other specialty organizations, this is a way that we can really be collaborative and have nurses' voice at the table to make change in the ways that we know it's best to make change.
Oh, thank you. Those are really great points. Betsy, it's important to have nurses engage with policy work. So pivoting to a broader perspective, how can ANA Vermont foster increased collaboration and collegial work with the many other nurse specialty organizations in Vermont?
I think this is a really important question, Kate, and you bring up a really sort of great idea and where we could go moving forward. I think, there are so many different nursing specialty professional organizations that can sometimes separate us or silo us in some of our policy discussions. And so I think the more that ANA Vermont can bring these groups together would be a great starting point. Are there ways that we can work with the Emergency Nurses Association of Vermont on workplace violence? Are there ways that we can work with, the AORN chapter of Vermont on, surgical smoke safety and things like that? I think there's so much opportunity that we can actually partner and support each other with, that we could actually become a really strong force within the state in driving policy.
Yes, and hopefully this wonderful interview with you will help inspire people to get involved and to collaborate more together. Is policy advocacy work by nurses adequate now, and how do we improve it locally, nationally, and globally?
I think we're at a really big turning point. I think now more than ever, people are listening to nurses. I think legislators are listening to nurses more. I think that even our presence within the media is changing. And I think this has a great deal to do with, our impact on the COVID-19 pandemic, as well as the recognition of the nursing workforce and how we really are the backbone of the healthcare system. So I think that to me, it will never be adequate enough. I want, more than one nurse at every single table that we belong at. And I think that it's really just about us starting to take ownership of this, getting involved, having a voice, not feeling siloed or divided when we don't necessarily agree on every policy position, but recognizing that we're really going to make the change that we need to for the country as well as our patients when we all partner together. And that can be at the local level, the national level, and even globally as we're starting to see, foreign nurses joining our workforce and us integrating more care on a global level.
Yeah, you are exactly right about that. And hopefully this wonderful interview and some of the work done with ANA Vermont with the Practicum project will help inspire people to participate more. Thank you so much, Betsy. This has been an incredible interview. And for more information, please go to ANA Vermont and see how you can best advocate for Vermont and your